Hi, I'm Kelly from North Shore Eye Care. Today I'm sitting with Dr. Gerri Competiello. She is the newest doctor on our team here at North Shore Eye Care, and she's an audiologist. I just would like her to give us a little more information about audiology and how she came to get into audiology and come to be working with North Shore Eye Care. So how are you today?
Good, how are you?
Good, thank you. So tell us a little bit about yourself first.
I am a mom of a rambunctious 4-year-old, and so he takes up a lot of my time. His name is Noah, and he is pretty much my life other than audiology and work, which is good. I am a marathon runner, so I'm gearing up for my 5th half marathon this October, which tends to give a lot of stress relief, dealing with a 4-year-old jumping all over the place.
I have a 4-year-old, so I know what you mean.
So it gives me my own quality time. I'm born and bred here on Long Island, come from a big Italian family, so we're big and loud, and everyone knows everyone's business, so we're always busy and always running, so that's a little bit about me.
Great, that's nice though, very nice. Well, when did you decide you wanted to get into audiology?
That's a great question. Believe it or not, when I was in college, I was doing my undergraduate, and I'm the oldest of 20 grandchildren.
Oh.
And at that time, one of my cousins was born, and he was born with atresia, which is a malformation of the pinna and the external ear canal. So he was going through a whole bunch of testing to see whether or not the cochlea was viable in that ear, and then going through different treatment options to figure out if we could open up the ear or if he would have to wear what's called a bone-anchored hearing device so he could hear out of that ear. And I found it just so fascinating, and I was so consumed by it between his therapy with speech and OT, and then going to the Milneck school, that I said, this is it. This is what I want to do. So that's how I decided to become an audiologist. He is now 18 years old. He is in college and doing well, and they actually opened up his ear, and he has a cosmetic ear on that side, which is fantastic, but he was placed with a bone-anchored hearing device on that side, which is called a BAHA, and doing very well.
And it saved his hearing?
And it rehabbed his hearing to within the acceptable range of hearing on that side. So now he has a BAHA on one side and normal hearing on the other side, so he does quite well.
Great. What is involved with the education and training to become an audiologist?
So back when I went through college, it would be your undergraduate in communication disorders and then graduate as a master's in audiology. That has now changed over to a doctoral degree. So just like any other form of doctors out there, whether it be ophthalmology or chiropractor or a regular physician, they will have to go for an undergraduate of 4 years and then a graduate program or a med school per se for another 4 years, with then a year of residency underneath a certified audiologist. So for me, I have 3 degrees in hearing, my bachelor's, my master's, and then went back to school for my doctorate when it transitioned over.
Great. How long have you been an audiologist for?
I have actually been an audiologist for 15 years, going on 16. I'll never forget when I first came out of school, they would be like, you're a baby. There's no way that you could be an audiologist or have that type of schooling underneath. But it's been 16 years, and I've had a wide array for my background. I started off in the Cochlear Implant Center in Lenox Hill Hospital and dealt with many of the otologists and ear, nose, and throat doctors that are renowned around the world. After that, I went into private practice, where I worked with treatment and diagnosis of hearing loss, as well as dizziness and central auditory processing disorder. After that, I moved into the manufacturer's side, so I was their trainer, where I would go in and talk to the audiologist about certain hearing devices, what the features were, how to help with problem fits of those particular patients, and then came here. So
great.
Wide array.
I was going to say, it sounds like you've done it all. That's great.
Yeah, pretty much.
How is hearing loss treated, or what is the course of rehabilitation?
Great question. Many times when people walk into the office, they are unaware that they have some type of hearing loss, as mild or profound as it may be. Many times it's spouses that are...
I was going to say, are they just in denial?
As many times they are in denial, but many times it's the spouses that are saying there's something wrong with your hearing, you need to go get it checked out. The reason being is because it's such a gradual process. If someone were to wake up tomorrow morning and have a hearing loss of a flat moderate, which is about 50% of their hearing gone, they would be at an ear, nose, and throat doctor right away saying something happened. But because it happens so gradually, many people don't realize that it is happening. At that time, once they are diagnosed, it's all about diagnosis and then the prognosis. The earlier the diagnosis is, the better prognosis it is for hearing devices, which in many regards tends to be a new factor when you're dealing with the public and patients, because they would say, oh, it's good enough for my hearing, or for my age, or, oh, it's not that bad. Now what we're starting to see is that with the studies that are being produced right now is that the sooner they get in and diagnosed and have a course of treatment, whether it be hearing devices or assistive listening devices for certain aspects, the better prognosis they have. And many times I will take the analogy of early intervention for children. Once that child is diagnosed, the sooner they get speech or OT, the better off that they are and easier to be mainstreamed into a formal classroom. Same thing goes with hearing. And it's much harder to deal with nerves than it is with a muscle. So once that nerve has a little bit of a distortion quality, you can't get that back. You can't get that clarity
But is it
back.
like you're saying you can actually slow or stop the progression?
You can not slowly or stop the progression of hearing loss. So when we do tonals on these patients and see where their threshold lies at each particular frequency, that may change over a course of time, and that's natural progression, unfortunately. But there is something called auditory neuropathy, where as year after year you walk around with the hearing loss, that clarity ability tends to drop. And when you wear hearing devices, that clarity ability will stay the same. Although those thresholds may change, those clarity abilities stay the same, and that's what we're looking for. Many people don't realize that the ears and the brain work as a system. We don't hear at the ear level, we hear at the brain level. So when we have hearing loss, what happens is that there is no information going from that ear level to the brain level because of that loss.
Right.
So the sooner we can get stimulation in there or a hearing device in there to maintain that that communication from the ear level to the brain level, the better prognosis that they can do in adverse listening environments.
Great. What is the most rewarding part of your job?
Oh, there's a couple of different things that are most rewarding. One thing is that when patients come in and they're reluctant to wear hearing devices. They know they have a hearing loss and they're reluctant, and you sit there and you talk to them about their struggles, and you know that they're going to do well with hearing devices. And then a couple of months later, after they're used to the devices, they come in and they say, you know what? I don't even realize I'm wearing them anymore. Or I jumped into the shower the other day with them. I didn't realize they were on. That is rewarding because they obviously are perceiving benefit from them, that they're wearing them and they're so comfortable for them that they don't even realize that they're on. Another great rewarding feature is seeing the pediatrics, seeing these kids come in and they're showing off their color hearing devices, and they're like, oh, I got a pink one now, or I have a blue one now, and they love it. And seeing them, really mature in their academics and do really strive and flourish.
Right. I guess it's like instead of it being something that they're uncomfortable with, they're just so happy that it's helped them.
Right.
That's really nice. What is the most challenging part? Is there a challenging part?
There is a challenging part. One thing is that there is a stigma to hearing devices, and unfortunately, hearing devices are not as acceptable as glasses per se. But the manufacturers are doing great, making tremendous strides in making these more acceptable. The challenge is that when patients walk in the door, and although they hear, they're not making sense of completely all the sounds, and making sure that they understand what is happening to their hearing, and making them aware of what will happen long term, or or really saying to them, okay, here's the hearing at hand. We can't restore normal hearing, and even wearing hearing devices are not going to make you hear like you heard in your 20s. That can be a little bit of challenging. I do love challenges. That's why I was a trainer for a manufacturer, and I would be called in for the problem fits and try to figure them out and make them happy so that way they could hear well with them. And one thing that is challenging about hearing versus any other field is that we're dealing with perception. No two ears hear sound the same. So
Right.
what you may perceive as pleasant, I may perceive as not pleasant. And you're trying to take the art of fitting the hearing devices with the scientific background of it and meshing it together for that patient that's sitting in front of you.
That's great. I guess also what, the way that you're able to help somebody, it's just gratifying when you're able to really overcome one of the challenges.
Absolutely.
So that's really nice. I know that we were briefly saying that there's a few different conditions that have connected to hearing loss. What are some of those? I guess we have the diagram here.
Yeah.
These really shocked me. I was saying to you before, I had no idea. Chronic kidney disease is connected with hearing loss, Alzheimer's, dementia, cardiovascular disease. So I guess you see a lot of patients in the office going through conditions like this. And
so the BHI, which is Better Hearing Institute, put out this really great graph. And again, it all goes back to what I was saying before. The two ears in the brain work as a system, and when you're not hearing, it does affect a lot of other things. It affects you emotionally, it affects you cognitively, it affects you socially. Many people that have hearing loss tend to digress or go into a cocoon and have depression. Those patients sometimes also, too, when they have hearing loss, because they're focusing so much on what's being said to them and they're not hearing everything and they're not getting all those nice speech details, their brain is trying to fill in the blanks. And because of that, then it kind of heightens them. So their blood pressure goes up, their heart rate goes up, and then that can also lead to, unfortunately, high blood pressure and all of that. It puts stress on the body.
Right, that makes sense.
So any type of trigger, which hearing can be that trigger, can heighten other aspects of the body and create a high correlation to those other aspects.
We'll definitely have to sit down again and talk in greater detail about some of these different conditions that are involved and resources, maybe for people who are going through things like this.
Yeah.
But it was really a pleasure speaking with you. Thank you so much.
Thank you for your
Thank
time.
you. If you would like to schedule a consultation with Dr. Gerri Competiello in our Smithtown office, you can call us at 631-265-8780, and she would be happy to meet with you and give you an evaluation. Thank you.